Having discussed the gram-positive bacilli, let us now get going with the gram-negative bacilli, because as I told you, all the bacilli are usually gram-negative. So we start with the family which has maximum members, and that's the Enterobacteriaceae family, which you classify on the basis of the lactose fermentation. But before I begin with this, let me tell you one common table that will sum up 90% of the things for you. These are all the members that you have in the Enterobacteriaceae family, and when you talk about which of them are lactose fermenters, remember all the ones with K in it: E. coli, Klebsiella, Enterobacter, Citrobacter. All these are going to be lactose fermenters. Whereas everything else like Shigella, Salmonella, Proteus, Yersinia, all of them are going to be non-lactose fermenters. So simple: K, E. coli, Klebsiella, Enterobacter, Citrobacter, they are lactose fermenters. So now I can come back to my classification. Yes, all these four main organisms that I was talking about, all the others become non-lactose fermenters, but we have one exception called Shigella soni. And that Shigella soni is going to sleep and then wake up very, very late. Sota hua, right? So he's going to wake up late. He's a late lactose fermenter. He doesn't ferment lactose immediately. He wakes up very, very late. So that means the classification part is done. Now let's move on to the urease ability. Out of this entire family, only Klebsiella and only Proteus is going to be urease positive. All the others are going to be urease negative. So should we do one common mnemonic for the entire bacteriology for urease? Yes, so I have learned you are gonna turn pink either when someone is gonna give you a punch, because of course the impact, or you're gonna blush pink when someone is gonna kiss you. So simple, you are gonna turn pink with a punch or a kiss. So the mnemonic for urease organisms are punch kiss. Out of them, note, the Proteus and Klebsiella were belonging to this family. The P and the K were belonging to this family. Other than that, urea plasma, common sense. Urea word hai urease. Helicobacter pylori, common sense again, because again Helicobacter has that urea breath test for diagnosis, so we know it. Then we've done Cryptococcus, Nocardia. These two you will have to learn. One fungus, one bacteria, Cryptococcus and Nocardia. And S and S may the two Staphylococcus saprophyticus and Epidermidis. I hope you remember which family of staph do they belong to. They belong to the coagulase negative family of staph. So you're done. So you are going to turn pink with a punch and a kiss. That is urease positivity. Over here, we've got urease positivity. Now coming to the motility aspect. So remember, that is E. coli motile. Yes, Enterobacter motile. Citrobacter is going to be motile. Salmonella mostly motile, can be non-motile also. Ma'am, Proteus motile. How have you learnt all this? Okay, let me simplify it for you. If you remember, we had a mnemonic that wherever the word illa will come, illa in south means no. So wherever the word illa will come, Klebsiella, non-motile. Shigella, non-motile. Okay, Salmonella also has illa, so non-motile, but can be motile. So usually Salmonella is motile, but remember there are some rare Salmonellas, like we have Gallinarum, we have Pullorum. These are the Salmonellas jo rare wale hain. Those are the ones which are non-motile. So remember the rare ones, Gallinarum, Pullorum, these are non-motile. The Salmonella typhimurium, usual ones are motile. All the others, they don't have illa, so they are all motile. Yersinia can have a differential motility. So that I'm going to tell you in a while, that you'll have to wait for. So simple, the Klebsiella, ella no motility, Shigella no motility, Salmonella, Gallinarum, Pullorum no motility. Now coming to the IMVIC testing. First you'll have to understand what is IMVIC. So this is the IMVIC testing that we've got. So I stands for indole, M for methyl red, VP for Voges Proskure test, and C for citrate. This is the IMVIC testing that you have. What have I said? If indole, methyl red and VP come positive, can you see a red color in which I've written them? So when they are positive, I'm going to get a red color for them. Whereas if citrate is positive, if citrate test is positive, I'm going to get a blue color for it. So you should be knowing these colors. For all of them, red color is positive. For citrate, blue color is positive. So now can you make the diagnosis over here? Whenever they are placed in 4 tubes, automatically understand that they are talking about IMVIC in that order. They've written it in the same order. So remember, red color, ma'am, first 3 ke liye to if red color is there, that is positive. Red color, yes, I positive. Next, red color, positive. VP mein I don't see red color, so negative. Citrate mein what is positivity? Blue, but here I see green, so this means this is also negative. What do I see? Plus, plus, minus, minus. That is a case of E. coli. Let's move on to the next one. Again, they have put it in the same order, that is IMVIC. Do you see red color? No, negative. Again, negative. The third tube is showing me a red color, that is positive. And citrate is showing me a blue color, that is also positive. So, ye kya bana? This is negative, negative, positive, positive, and that is a case of Klebsiella. So, simple, ulta hai. E. coli is plus, plus, minus, minus. Klebsiella is minus, minus, plus, plus. So, let me come back to this table and fill it up. E. coli plus, plus, minus, minus, and Klebsiella minus, minus, plus, plus. After that, you will realize who of them are shy. So, you will say, ma'am, I am shy. I'm shy. So, slang mein likhta hai, I'm shy. M for methyl red. Which are the ones which are only methyl red positive? Shigella and Yersinia. So, when I talk about Shigella, it is only methyl red positive. Yersinia is only methyl red positive. Last one that you have is Salmonella. Now, Salmonella, I will tell you in a while, has a test called the Vidal test, जिसमें एक बहुत famous, Vidal का होता है OH, which you have in Vidal, right? I've converted that OH of Salmonella into O से minus बन गया, and H has been converted into a plus. So it is minus, plus, minus, plus. That is the IMVIC testing for Salmonella. Others you don't have to know because they show you a very variable reaction. So simple. E. coli, Klebsiella are opposites. Shigella and Yersinia are only methyl red. So I'm shy. And finally, OH say Salmonella, Vidal test jaise OH, this is minus, plus, minus, plus. So this entire table is done and 90% of your headache is over for this chapter. Now let us move forward and talk about how did you see this lactose fermentation? What are the three main media on which you can see it? MacConkey, Cled, and eosin methylene blue. Let's start one by one. What is the mnemonic for MacConkey, guys? We always say that MacConkey is going to be a pretty pink plant. What is pretty pink plant? Because if lactose has been fermented, you are going to get a pink color. So the pink over here stands for lactose fermentation. Pink plant. So what all does it contain? P for it contains peptone. L for, of course, lactose fermentation, dekh rahe ho, so it contains lactose. And because it is telling you a difference between lactose fermentation and non-lactose fermentation, that makes it a differential media. So P for peptone, L for lactose, A for obviously agar, it is an agar. N for neutral red. Now tell me something. When the color is changing, there must be an indicator that you have added. What makes it an indicator media? What is the indicator dye? And that is going to be neutral red. Very famous previous year question. And the T stands for taurocolate, like sodium taurocolate. Those are bile salts. They are always toxic. They will only allow this family to grow, Enterobacteriaceae. They will not allow the other members to grow. So that makes it a selective media. So tell me, MacConkey is what? A differential, indicator, and selective media. What makes it differential? Lactose. Indicator, neutral red. Selective, taurocolate. That is why I said a pretty pink plant is MacConkey agar. What's the next one? The next one is Cled. Cysteine lactose electrolyte deficient. I can see over here that the fermentation, if lactose has been fermented, it's got a yellow color. Over here, yellow color. But ma'am, background to blue hai. Yahan par it is all blue. What is the indicator? This means blue. Bromothymol blue. The indicator is said to be bromothymol blue over here. What was the indicator in MacConkey? Neutral red. What is the indicator here? It is going to be BTB, bromothymol blue. MacConkey mein kya color aaya tha? Lactose fermentation, pretty pink plant. You got a pink color. What did you get with Cled? You got a yellow color. Better kaun sa hai? Cled is better. Why? Because it is less inhibitory. It will allow gram positive and gram negative organisms to grow. This is a very famous PYQ, which is better out of MacConkey and Cled. Cled is more comfortable. It allows everyone to grow. So Cled is what I'm going to use. Coming to the next, there's another one called eosin methylene blue, and you can see lactose fermentation में क्या आया? Ma'am, कुछ ऐसा brown, blue black stuff है. But there's a green area, a green halo, like God is there. It has an aura around it. That is eosin methylene blue. So you say that colony can be of any color, but that green sheen around it is very, very characteristic, and that is eosin methylene blue. That makes up the three media that you have for lactose fermentation. Now, the first member that I'm going to discuss in this family is going to be E. coli, and you can see that E. coli causes a lot of things in our body, but it causes two main things, diarrhea and UTI. These are all the diarrhea wala strains that I'm going to discuss for E. coli in front of you, and you will realize entero something E. coli. So entero something E. coli. Entero some alphabet E. coli. So that entero E. coli remains the same. Now I just have to see what is it in between that they are talking about. So please note over here, entero Pathogenic E. coli, P for P, what does it cause? It causes P for pediatric diarrhea or infantile diarrhea. Entero P for pathogenic, P for infantile. How does it cause? Another P coming up your way. It causes it by bundle forming P for pili. How is it coded? P for plasmid. How simple. Pediatric diarrhea or infantile diarrhea is caused by enteropathogenic E. coli, which is going to form bundle forming pili, and those are plasmid coded. And please note, this enteropathogenic E. coli shows you attachment, effacement, lesions. You can see this is a previous year AIIMS question. You can see the bacteria has come and attached and effaced. Effaced matlab thoda flat ho jayega. So when it comes and attaches to the intestine, it's gonna efface it out. Okay, how have I learned it is attachment to bachon se hota hai na. You have attachment with kids. So this pediatric wala thing is gonna result in the famous attachment, effacement, lesions. Coming to next. Enterotoxigenic E. coli, T for toxigenic. So this will cause something with T, that is traveler's diarrhea. This causes something called traveler's diarrhea. So when you travel, what do you look at? The colonies, the culture. So how are you going to actually cause this diarrhea? By the colonization factor antigen. This can also cause pediatric diarrhea, but infantile pucha to put it in the P wala. Okay? T for T, traveler's diarrhea by enterotoxigenic. How? By colonization factor antigen. Entero-invasive E. coli, invasion. If something causes invasion, it will cause bleeding, dysentery. So can I say this is very similar to Shigella? Because Shigella also causes, dysentery. This also invades and causes dysentery. If it is invading, matlab, ma'am, this is very dangerous. It has the virulence marker antigen. It has the famous virulence marker antigen. And please note that this virulence marker antigen is the reason that it's invading and causing all that bleeding. So, iska mnemonic kya hai? Invasion se related. Invasion se related, it's causing bleeding, and that means it's very virulent. And tell me one thing, I had told you some test called Sereny test. And how did we learn it? We had learned that Sereny test because invasive. What did I say? I said Sereny test because it is for entero-invasive E. coli. And entero-invasive E. coli ka bhai hai Shigella. So this is going to be seen in entero-invasive E. coli and his brother Shigella. And what is this test? You have basically inoculated these bacteria into the guinea pig's eye. And what did the guinea pig's eye end up showing you? A lot of redness, keratoconjunctivitis. It started showing you keratoconjunctivitis. So, matlab invasion, man, guinea pig ke aankh mein you are putting needle. It is a very invasive test. So, invasive E. coli is going to be Sereny test, seen in invasive E. coli, seen in Shigella. And is this similar test also seen in Listeria? Because if you go back, in Listeria, I have told you Anton's test, which was also a similar keratoconjunctivitis. So these are the three things that show you the Sereny test. Now coming back, we are done with entero-invasive, going to enterohemorrhagic E. coli, hemorrhagic. It is going to cause something hemorrhagic, and that is the famous hemolytic uremic syndrome. Hemolytic uremic syndrome, how does it cause? This is what they're going to ask you. This is like, I'm going to make it into a big box because this is very important. What strain? O157H7 causes hemolytic uremic syndrome. And what is the main point? This is SMAC negative. What is it? Sorbitol McConkey agar. So you will say that, ma'am, McConkey was for lactose fermentation. Here you're trying to figure out sorbitol fermentation. Yes, all of them are also sorbitol fermenters. However, enterohemorrhagic E. coli is not going to be a sorbitol fermenter. It is going to be SMAC negative. O157H7 is SMAC negative. Coming to the next, enteroaggregative E. coli. Aggregate hua, if all of us get aggregated, we will persist. So this is going to cause persistent diarrhea. Means I will get a history of a diarrhea which has lasted for more than 14 days. That is what is the history that I'll get. And when everything is aggregated, what will it show on a cell line? It will show the stacked brick appearance. Stacked brick appearance is seen. So sab aggregate ho gaya. Aggregate hua to persistent diarrhea. Aggregate hua to stacked brick appearance. The last one is a diffuse aggregative or a diffusely adherent. Rather than the word aggregative, I will use diffusely adherent E. coli, which can also be there. These are all the diarrhea wala strains, and you've seen all their pictures also. Of course, it can cause UTI as well, and you all know the very famous UTI, and you all know, acha, let me ask you that if you have to do the diagnosis of, say now E. coli is causing urinary tract infection, can you tell me what is the cutoff? More than 10 to the power, how many colony forming units is needed? Yes, more than 10 to the power 5 colony forming. If this is there only, then you give the diagnosis of urinary tract infection. And what is this criteria known as? This is known as the Cass criteria. So is there any exception that when someone's urine sample is not showing this much of level, still you call it a UTI? Yes, there are 3 exceptions. I hope you remember the exception was SPA. What is SPA, guys? If, for example, you have done a suprapubic aspiration, then this 10 to the power 5 is not important. Even if you get like 10, 100,000 bacteria, that is also significant. Okay, next. If there is any gram-positive organism, like if the UTI is caused by Staphylococcus aureus or gram-positive में fungus भी होता है ना, like Candida, then also you don't have to consider the 10 to the power 5. Lesser is also significant. If the patient has consumed any antibiotics, or for that matter, if the patient has any diuretics, or the sample मतलब diluted urine होगा ना, under all these situations, you do not consider this criteria. These are exceptions, guys. Please note, suprapubic, gram-positive, antibiotics and diuretics. These are exceptions to the Cass criteria. What is Cass criteria? That 10 to the power 5 colony forming units se zyada. Let's move on, guys. The E. coli story is done. I'm going on to the next one. And what are these? The different types of Klebsiella that you have. Quick one word you will tell me. Klebsiella pneumoniae, which is known as the Friedlander's bacillus, of course causes pneumonia. Of course, it can cause meningitis and other things also. But this Klebsiella, tell me, K wala word hai. So is it a lactose fermenter? Of course, on a MacConkey agar, you will see a lactose fermenter. So what is the color? Pretty pink plant. I will see a pink color. You will say, ma'am, E. coli was also lactose fermenter. KK wala words. Klebsiella is also lactose fermenter. How will you differentiate? Because Klebsiella, please note, is going to be having a capsule. K wala sound. ठीक है, हिंदी याद करते हैं. K. Klebsiella is going to be capsulated. Anything that is capsulated is going to not only show you this colony, but it's going to show you a mucoid colony. Thoda shiny. Can you see this has that whitish as a flashlight chal raha hai, there's a shine. If I try to pick it up, वो mucoid है ना, jelly है. So this is going to be very stringy. So sometimes it is said that this is going to show you the string test positive. That is what it shows you. They say it shows you the string test positivity because it's very mucoid. If you pick it up, it's going to be thready. That is Klebsiella pneumoniae or Friedlander's bacillus. Coming to Klebsiella ozaini. Of course, it causes ozaini. And what is ozaini in ENT? It is a case of atrophic rhinitis. And what is atrophic rhinitis, guys? It means that the person is not going to smell anything. He will say, I am having anosmia, but everyone around him is like disgusted. Why? Because, oh my God, there's a foul smelling discharge. There's a foul smelling discharge. So, right, that is how the common public, is gonna react to him. So we say merciful anosmia, right? So that means that the person that cannot smell anything, but others can definitely smell because he's having a foul smelling discharge. That is ozaini or atrophic rhinitis. Coming to the next, rhinoscleromatis. Of course, Klebsiella rhinoscleromatis will show you rhinoscleroma. No points for guessing that rhino matlab this is going to involve the nose, and the nose is going to look very woody, very hard woody nose is going to be there. And this microscopically shows you 2 things. What are the 2 things? Have a look at this picture, guys. Number 1, it shows you big cells which are very foamy. Foamy matlab ma'am macrophage hoga. Yes, miculic cells. What do you see in rhinoscleroma? In rhinoscleroma, you see the famous miculic cells which are nothing but foamy macrophages, right? Inside them, you will also see the presence of these pink bodies, and those are referred to as Russell bodies. You know this. Russell bodies in pathology were seen in multiple myeloma, and that was immunoglobulins, isn't it? Same thing. तो ये भी तो disorder है ना, bacteria है, antibody you will make, correct? And those pink bodies are Russell bodies. So please note that you see the presence of the miculic cells and the Russell bodies in rhinoscleromatis. Finally, Klebsiella granulomatis. You know this causes donovenosis, right? What is donovenosis? You are gonna see 2 very important things. Firstly, genital ulcer. What kind of genital ulcer? Painless ulcers in the genitals. These are painless genital ulcers, and this shows you the Donovan bodies. How do the Donovan bodies look like? They show you the very classical safety pin appearance. That is what they are going to show you. Let me show you a picture. These are the Donovan bodies that you are going to see over here. And please note that you can see there's a big cell called a macrophage and inside them I can definitely see these safety pins lying. So what is a safety pin? If I draw a safety pin, guys, you will see that there is one area over here and one area over here. So safety pin appearance can also be said as the bipolar staining, and that is a very famous name given for it. Safety pin appearance is known as bipolar staining. So kaun sa stain hai? We can have a couple of stains. One of them is the right Giemsa stain, which is commonly asked. There's another one called the Vezin stain that they can ask, especially because other organisms also show you safety pin appearance. So now you're going to tell me what all organisms show you safety pin appearance. So kaise yaad kiya tha? We are going to make a safety pin over here and all of you are going to make letters around it. So sabse pehle I can extend this and it can become a V. So I can see it in Vibrio parahemolyticus. It can be seen in Vibrio parahemolyticus. Then out of this V, I can also make, instead of a V, I can make a Y over here. Ma'am, you can also make a Y over here. Correct. This can be seen in Yersinia pestis. That is going to be plague. Fine. Let's look at the other one. I can make a D out of it. If I make a D out of it, means I'm seeing which Haemophilus? Of course, Haemophilus ducrei. I can also make a B out of it. So that means I'm talking about Burkholderia, Burkholderia malai, Burkholderia pseudomallei. And finally, I can make a K out of it. So I have that in front of me. Klebsiella granulomatis. That also shows you the safety pin appearance. We'll do a quick recap. With V, Vibrio parahemolyticus. With Y, Yersinia pestis. D say Haemophilus ducrei. B say Burkholderia malai and pseudomallei. And K is going to be Klebsiella granulomatis. All of these show you the safety pin appearance. Coming back, the Klebsiella family definitely comes to an end to us. Don't worry about the genital ulcers, which is painful, painless. In a while, towards the end, I will give you a full summary of that. This one is painless. Learn that for the time being. Let's move forward to the other member of the family. That is just one word that you have to know. For Serratia marcescens, that is what you always say. And it has a lot of tongue twisters. So, sabse pehle to marcescens is a tongue twister, Serratia. But I'm going to focus on the R's. Serratia. So this is RR. What is RR? RR means it's going to produce a red pigment at room temperature. You can see the red pigment being made on the culture plate. And that red pigment, when someone, for example, has pneumonia, pneumonia with Serratia, that person will have sputum. On that sputum will start looking red. These patients have pseudohemoptysis. So what is this pigment known as, guys? P say protogeosin. It is going to be protogeosin. So please note that someone doesn't actually have blood in the sputum. It looks like blood in the sputum, pseudohemoptysis, because there's a red color pigment being produced by Serratia. So this is what you have to know. I hope you also remember, this is for INICET students. Can it be a control for something? Yes, it can be used as a control for filtration also, because the size is small, so it can be used as a control for filters as well. Let's move on to the next one. Guys, the next organism, any guesses? What am I going to teach you? If I've shown you swarming, of course I'm going to teach you Proteus. Now, there is not much about Proteus that I have to teach you. First, let me teach you, then I'll come back to that picture. First and foremost, when I say Proteus, have I told you us means it is urease? Is it a part of that Punch-Kiss mnemonic? Yes. Next, I'm telling you that us or simple S is going to remind you of swarming, and that is what we have in front of us. What is swarming? Swarming is something which is a concentric growth. It's a growth. People call it motility also. I prefer to call it growth because it's a concentric growth that you see. And where all do you see swarming? Swarming is seen in PVCs. What is PVCs? Jaldi se give me a full form. P for what? Proteus. V kaun sa wala P? V. Ma'am, go back to the P. It is Vibrio parahemolyticus. Any other Vibrio that can show it? Yes, Vibrio alginolyticus can also show it. So Vibrio parahemolyticus and alginolyticus. Then C, Clostridium. Clostridium tetani, and एक bacillus भी है जो C से है, Cereus. Bacillus cereus can also show it. And finally, right now I was teaching you Serratia, that red color wala organism, that can also show you swarming. So remember, Proteus, Vibrio parahemolyticus and alginolyticus, Clostridium tetani and Bacillus cereus, तो सारे C wala things, right? And finally S for Serratia. That is going to show you this round and round and round motility. But out of these, did you notice? For Proteus, I said that there is a phenomena that you see called Dine's phenomena. What is Dine's phenomena? Have a look at this picture. I can see one organism swarming from here and one organism that is swarming from here. So this is what you do for Proteus, guys. This is referred to as the Dines phenomenon, and please note this is done for the epidemiology of Proteus. And this I can't write and explain. I'll just explain it verbally because it's a story that I have to tell you. If you have a 10 people in the ward who have Proteus, how will you know that all of them have the same Proteus, or they have different types of Proteus? So if you put one Proteus over here from patient A and one Proteus over here from patient B, both of them will start swarming. तो अब simple है, if they are same, मतलब best friends हैं, they will come and hug each other, the swarmings will merge. If they are enemies, अलग-अलग है, they will come, but they will suddenly show a distinguishing, they will repel each other. So can I say, यहाँ पर ध्यान से देखो, are these lines meeting like this? Are they all merging into each other? No. I can see that they have made their territory very clear. There is a line of demarcation. So simple. What do you see in Dines phenomena? If the swarming is going to merge, if the swarming will merge, this means they are same strains. And if there is a line of demarcation that you notice, then that line of demarcation is going to mean that they are different strains. That is how you say that this is only and only used for Proteus. Remember, Dines phenomena is only for Proteus, not the other PVCs that I have mentioned. So yes, that is Dines phenomena. But note, it is different from what we call as the Dines stain. Please don't get confused in the paper. Dines stain is what we use for mycoplasma. That is totally different. What else does Proteus have? It is phenyl pyruvic acid test positive, yes. And whenever there is Proteus infection, the odor tends to be a little fishy. So yes, these are the things about Proteus that you're going to get in the paper. Done with Proteus, PPA positive, phenyl pyruvic acid test, then along with that Dines phenomenon positive, reaction kaun sa ho sakta hai? I've told you, it is going to show you the PPA reaction. Done. O for odor, fishy odor, S for urease, punch kiss mnemonic mein tha, and S for swarming. If I now go on to the next organism, which you can see in front of you in this family, is going to be Shigella. Now tell me guys, in Shigella, as you can notice over here, there is Shigella dysenteriae, Flexneri, Boydii and Soni, out of which we say the world is sleeping and India is very flexible. The world is sleeping means Soni is most common in the world and India is flexible. Flexneri is more common in India. Also, I hope you remember, all of them were non-lactose fermenters. All of them were non-lactose fermenters, but Soni late utha na, sota raha, late utha, late lactose fermenters. Now let me add on to the story. All of them are going to be catalase positive and all of them are going to be mannitol fermenters. But this Shigella dysenteriae, which causes the most dysentery, blood wala, ye alag hai. This is a little dark, a little different in life. It is catalase negative and it is a non-mannitol fermenter. That is what you have to know. This Shigella dysenteriae is very different, right? So what is the disease that I'm talking about over here? Obviously, when I'm talking about Shigella dysenteriae, I'm talking about blood in the stool, I'm talking about dysentery. So do you want to ask me the mechanism of action? Ya chalega? I think chalega, because I know for a fact that all these Shigellas, let me quickly ask you, do you remember what were the organisms that decrease protein synthesis? I have taught you that so many times, I don't want to repeat. So I had told you diphtheria toxin, Pseudomonas, Shiga and Shiga-like toxin, they decrease protein synthesis. How were Shiga and Shiga-like toxin decreasing protein synthesis? By inhibiting the 60S ribosome. So I think all of you know this and I don't have to actually explain this over and over again. Okay. Now we come down to how will you do the diagnosis of this dysentery. So firstly, if whatever I am teaching you for Shigella, remember there are some sisters called SS sisters, Shigella and Salmonella sisters are there. So whatever I'm teaching you for Shigella, please copy paste that in Salmonella also. Firstly, what do you do? For Shigella, we use the Sachs buffered glycerol saline. So we use the Sachs buffered glycerol saline that is basically used for the Salmonella Shigella sisters in their transportation. Now we come to enrichment media. We have two enrichment media, the broths. We have something called selenite F broth and we have tetrathionate broth. These are the two broths that I'm going to use. Broth matlab liquid na, enrichment broth matlab something liquid. So these are for both Salmonella, Shigella both. But selective media is a long list. There is something called XLD. Everywhere D means deoxycholate. There is called DCA, again deoxycholate. SS to naam hi rakh diya, Salmonella, Shigella, agar for the sisters. And H is hectin enteric. Enteric fever मतलब salmonella ना, तो salmonella, shigella दोनों के लिए. These are the selective media of which you get a question on XLD and DCA a lot. So I realized the salmonella sisters के लिए, salmonella shigella sisters के लिए SS, Sachs buffered glycerol saline. Then the S for selenite F broth is also important. And ये सारे D वाले, that is XLD, DCA, SS for salmonella shigella, enteric for salmonella shigella, all of these are going to be the same. I will tell you in a while that something is going to be different for salmonella, which I'll tell you. But yes, for the time being, tell me what is the treatment of this shigella. For the treatment of shigella, you have to go in for ciprofloxacin. So salmonella par jab aayenge, then I'll tell you the difference over there. So let me quickly start off with salmonella also. Salmonella matlab kya? Salmonella means enteric fever. What are all the features that you see in typhoid fever? A quick review of all the medicine aspect. Guys, what fevers? Step ladder pattern fevers. 1. Rise, stable, rise, stable, rise. Step ladder pattern fever. Yes, not step ladder electrophoresis pattern, because that was in pathology. The step ladder electrophoresis pattern in pathology was seen in apoptosis. Okay, just a very random correlation. But step ladder fever, salmonella, enteric fever. What kind of ulcers in the GIT does it cause? Longitudinal ulcers. They are going to be longitudinal. How did we learn it? Tie, typhoid. Tie seedha hota hai. Tie is worn in a long axis. So typhoid ulcer is going to be learned as a tie, longitudinal. What kind of diarrhea? Pea soup diarrhea. Then we have a very famous sign called the Faggot sign. Faggot sign matlab that this patient has fever. Of course, typhoid hai, fever hoga. In every fever, I expect that the heart rate should go up. But here there is bradycardia. The heart rate dips, and that is referred to as the Faggot sign. Moving on to, yes, there can be a soft palpable spleen liver, hepatosplenomegaly ho sakta hai. And there are some very famous spots called the rose spots. Rose spots are seen usually in the second, third week, and if you apply pressure on them, they are going to fade. These are all the features which you know from medicine about salmonella. And now I can conveniently say that salmonella mein sab kuch shigella wala tha. So if I ask you, everything over here of salmonella shigella was the same. So now whatever I have taught you, sab kuch as it is, you are gonna erase the shigella from here and you're gonna add the salmonella now over here. But guys, please note that for salmonella, there is something called as the Wilson and the Blair media. There is something called the Wilson-Blair media, and Wilson-Blair media shows you jet black colonies. So finally, this is only for salmonella. This is a selective media only for salmonella. So remember, salmonella and shigella were sisters. From transport to enrichment to selective, सब कुछ साथ में चला. But who ended up creating a rift between the sisters? There's a boy named Wilson. Wilson came and the two sisters got separated. So salmonella said, I am going away with Wilson, but that was a black day. Sisters should never be separated. So salmonella को किसने ले लिया? Wilson has separated her from her sister, and that is a very bad thing to do. So jet black colonies is what it's gonna get. But how else do you do the diagnosis of typhoid fever? There's a very, very famous mnemonic known as the BASU. So quickly, how did we make a mnemonic called BASU? Depending on which week the patient has come to you in. Week 1, 2, 3, 4. So sabse pehle, if the person has come to you in week 1, you know you're gonna do a blood culture, right? If the person comes to you in week 2, you will do antibody testing, and that is very famously known as the Vidal test, which I'll show you a picture of. In week 3, you will do a stool culture, and in week 4, you will do a urine culture. These are the 4 things that you can do. Overlap hota hai. It's not exactly 1 week, 2 weeks. There can be overlap, but this is for learning. So BASU, blood, antibody, stool, urine. Out of that, you know, this antibody or this Vidal test is very, very important. Before I tell you the Vidal test, I have to tell you the concept of that the typhoid or the enteric fever or salmonella, whatever you want to call it, they are made up of 2 antigens called the O antigen and the H antigen. Remember, O antigen and H antigen. What are their other names? O antigen is known as the somatic antigen and H antigen is referred to as the flagellar antigen. This you know from your general microbiome. Now please note that when I say O antigen, this is the same for all the salmonellas. For Salmonella typhi, for Salmonella paratyphi A, for Salmonella paratyphi B. So tab का क्या मतलब है? I'll repeat it again. It is the same for Salmonella typhi, for paratyphi A and for paratyphi B. It is the same for all of them. ठीक है, तो whether I get O antigen positive reaction, I will never know which kind of typhoid is it. But flagellar antigen is different. Typhoid का flagellar antigen अलग, paratyphi flagellar antigen separate, and paratyphi B का flagellar antigen is separate. So when I'm going to do a Vidal test now, finally, when I do a Vidal test, you will see that TO is written, but that means ये O antigen तो सबका है, typhi, paratyphi A, paratyphi B, just one common. Whereas H antigen is written thrice. Why? Because the H antigen for typhi, for paratyphi A and for paratyphi B are different. So now tell me, if you get a reaction, what are you trying to test? Vidal mein what will you take? You will take a blood sample. And what are you trying to test? Does my patient have antibodies? ठीक है, तो in my lab I have kept these antigens and from the patient I'm taking antibodies. Let me see reaction हुआ या नहीं. Yes, with O antigen I got a reaction. But will I get to know whether it is typhi, paratyphi A or paratyphi B? No, I just got to know typhoid है. कौन सा typhoid है? I will have to do this. I got a reaction with typhi का H. This means this is a case of Salmonella typhi. Second scenario, O antigen मतलब typhi है. O antigen reaction is there, typhi is there, and A वाला flagellar antigen has come. Paratyphi A is the infection. Next, O antigen के साथ testing है, typhoid तो है. Which typhoid? Now H tells me that it is paratyphi B. So first everyone's understood how to do the diagnosis. O तो will come in every case. Where has the reaction antibody to the H antigen comes, that is going to make a difference. Now remember, if only and only, now you're going to learn a mnemonic called OH-OH. OH-OH. So please note that in Salmonella typhi, if you have to read a report, which appears first? O antigen के against antibodies. Next, which appears second appearance, that is against the H. Then how do they disappear? Again OH-OH. Who disappears first? It is going to be antibodies against O. And who disappears last is going to be antibodies against H. So what did I say? OH-OH. First this will come, then this will come. First this will go, then this will go. So if I say only antibodies against O are seen, only antibody, abhi H आया ही नहीं. So you will say, ma'am, this must be some very early infection because this is the first one to appear. Whereas if I say there are antibodies only against H, या तो typhi वाला H or paratyphi वाला H or paratyphi B वाला H, whichever, anyone H is there, only H is remaining. Only H is remaining, everything else has gone. So you will say, oh ma'am, this is probably the last part of the infection that you have. And finally, what do you have for vaccine? So please note, for vaccine, O is never there and all the H's are there. And what is the concept behind it? Because Salmonella has a third antigen called VI antigen. VI antigen is something that covers O. So if this is O, VI is going to come and cover it, which means that antibodies against that O to cover ho gaya. Antibodies against O will never be formed, but antibodies against all the H's will be formed. And that is what you see in a case of vaccine. So remember, vaccine ka VI, this is the antigen that you use for vaccination. Now guys, I want to tell you that although I taught you OH-OH, but there is a controversy over here. You know why I taught you OH-OH? Because that is how you do the reading of the report in the paper. However, if someone asks you a simple one-liner, thoda controversy hai, dhyan se sunna. If someone asks you which is the simple one-liner, that is, which is the most immunogenic antigen and which is gonna give you the earliest and highest antibodies. Earliest and highest antibodies, remember the answer is H. You will say, ma'am, abhi to you said O appears first. Yes, that is only for reading of your report. But remember, if a single one-liner comes, because H is very, very immunogenic, it's said that it can appear and it should ideally appear first in the blood. Okay, so your Basu mnemonic is done. Do you want to see how a Vidal test looks like? It's a slide test. It is a kind of a slide agglutination test that you have. You can see that there are some. Tell me, kahan agglutination hai, ma'am? O mein agglutination lag raha hai, dot dot dot. So this must be typhoid. Kaun sa wala typhoid? So I can see H may be agglutination hai and paratyphi A may be agglutination hai. So these are just different scenarios. So if H was here, it must have been typhoid. If AH mein hota, this must have been a case of paratyphi A. If BH would have shown you, it must have been a case of paratyphi B. NCPC are negative control, positive control. Again, not important for you to know in the paper, but you need to know how to make your diagnosis. So, jahan bhi aisa dot 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 dikhega, this means the agglutination test has occurred. But again, let me tell you, is Vidal specific? Not at all. Vidal is a non-specific test. Let me tell you, in cases of COVID, Vidal test used to come positive. It's a non-specific test. So you have to not rely on one testing. You have to do serial testing. You have to repeat the test again. Only if the antibodies keep on rising, then you will say, yeah, this is a case of typhoid. One test is never diagnostic for it. Okay, on that note, now we have newer tests called TIFI-DOT and DOT blot. They also measure the antibodies. They are card tests. They are rapid, more rapid in comparison to Vidal. So you should just know their name, TIFI-DOT and DOT blot. Finally, if I want to end, did I tell you for Salmonella and Shigella, everything was the same. The enrichment broths were the same. The selective media were the same. But who finally split up the Salmonella Shigella sisters? They were split up by the Wilson boy. This Wilson boy, very dirty boy. He has created a very black history. What has he done? He has separated the sisters. This is the only one which cannot be used for Shigella. So remember, Wilson is gonna go with Salmonella. Wilson is gonna go with Salmonella. What color colonies? I told you, no, very bad thing he has done. Jet black colonies for Salmonella. That wraps up Salmonella for all of you. Salmonella, Shigella ho gaya. Now we move on to the next member of the family, last one, that is Yersinia. Let me first tell you, you must have heard of Yersinia pestis, Enterocolitica and pseudotuberculosis. अब इनमें से कौन कहाँ जाता है? Yersinia pestis is what you call as plague कराते हैं ना, rat वाला plague. That doesn't come in the Enterobacteriaceae family. Enterobacteriaceae family includes Enterocolitica and pseudotuberculosis. Together they are known as Yersiniosis. Yersiniosis comes in the Enterobacteriaceae family. I'm going to study this first because what do all of them cause? Both of them are associated with gastroenteritis. Because their word is only telling me na Enterocolitica. So both of them cause gastroenteritis. They are the ones called Yersiniosis. They come in Enterobacteriaceae family. Plague does not come in the Enterobacteriaceae family. So please note, if I have to differentiate between them, Yersinia is non-motile. But these two people who have made a pact, these Yersiniosis, they are saying that we will show a different type of motility. They say that we are going to be motile at 22 degrees centigrade, but we will not be motile at 37 degrees centigrade. Does this remind you of any other bacteria? So remember, ये वाला जो motility होता है, this is referred to as the differential motility, where it says I will be motile at one temperature, not at the others. And this is seen not only in Yersiniosis, this is also seen before I told you Listeriosis. And I told you Listeria was the tumbling tully man, remember? So I told you that you can be drunk at a young age of 20 to 25, but you will not be able to consume that amount of alcohol at 37 because you have aged and your liver is starting to give up. So this is motile at 22 but non-motile at 37. That is something which you see with Yersiniosis and Listeriosis, and that is a differential motility. So this is what you need to know about Yersiniosis. Plague though is not at all motile. What about their urease test? Remember, Yersiniosis is going to be urease positive and the plague is not interested in all these things. Now, if I ask you, how are you going to do the lab diagnosis? Another commonality that I'm going to find between Yersiniosis and Listeriosis is that they show you cold enrichment. They also show you both of them show you cold enrichment. That means that if you will grow them at normal temperature, so they will grow. But if you put them at a cold temperature, they'll be very, very happy. So remember, for the diagnosis of Yersiniosis, especially Yersinia enterocolitica, they will grow at a normal temperature also. But if you grow them at 4 degrees, they are very happy. Cold enrichment, like I said, cold enrichment is not only seen in Yersiniosis, it is also seen in Listeriosis. So in Listeria or Yersinia ka काफी अच्छा fact है. We will both show differential motility, we will both show cold enrichment. Coming back, if I talk about Yersiniosis, especially I said Yersinia enterocolitica, it has a very famous family called the bullseye appearance. You can see there's a dark center and a lighter area. There's a bullseye appearance on which agar? There is going to be a CIN agar that is used for Yersinia. So bullseye appearance is noted. Everyone's clear with Yersiniosis, enterocolitica and pseudotuberculosis? Because I'm talking about Yersinia, to khatam karte hain na, although it's not a part of this, but let's finish off plague also. What is plague? So as I said, plague is something which is caused by Yersinia pestis, and I think everyone knows that this is something related to rats. And how is the transfer going to occur? The vector is going to be the rat flea. This much information everyone knows. ठीक है. So what are the types of plague? Rat bite से होता है या rat flea से होता है. So what are the types of plague? Bubonic plague, in which of course buboes are there. Buboes क्या होता है? Painful lymph nodes. So painful lymph nodes are there, of course. That is buboes. Count the alphabets. It has 7 alphabets. So how many days is it going to take for incubation period? 2 to 7 days. Similarly, there's something called pneumonic plague. Pneumonic, ma'am, pneumonic मतलब lung involvement. Lung involvement हमेशा जल्दी होता है. It's going to happen very jaldi. So the incubation period is very short, 1 to 3 days, and that is the reason that this is a bioterrorism agent. Coming to the last one, there is something called septicemic plague. Either bubonic can change to septicemia, pneumonic can change to septicemia, anything can change to sepsis. Na? So that also has a 2 to 7 days. So if I write sepsis, that also has roughly 6-7 alphabets. Na? So 2 to 7 days is going to be the what? The incubation period. And please note that this is what we call as Black Death. You must have heard Yersinia pestis or plague is referred to as Black Death. So how is it going to look like? If you remember, sometime back I told you that this shows you the very famous safety pin appearance. Kuch yaad aa raha hai? I give you a mnemonic quickly. I'm not going to write it again, but I'm going to make you revise. What all shows you safety pin appearance? Ma'am, you made a V first, Vibrio parahemolyticus. Then yes, ma'am, you made a Y also. You said कि हाँ Yersinia pestis exactly in front of you. Yersinia pestis. Then you made a D, Haemophilus ducrei. You made a B, Burkholderia, and you made a K, that is Klebsiella granulomatis, all of that. And yes, Yersinia pestis is in front of me. It can definitely show me the beautiful bipolar safety pin appearance. Now tell me, if I have to grow this on a culture media, so what is it? That is going to be the ghee broth. And on a ghee broth, like ghee, you must have seen if your mother puts ghee in your food. So you see ghee as a drop by drop aata hai. So can you see something dropping down? On ghee broth, it shows you a stalactile growth. It shows you a stalactile growth on a ghee broth as if something is falling down. That is very important for Yersinia pestis. I hope you all remember safety pin to pehle bhi pada hai, copy paste it over here. Now I've taught you the stalactile growth on ghee broth, which is much expected, and that definitely wraps up all of your most important Enterobacteriaceae family. Now what you will do, you will go back to that first table that I gave you, revise that, and your entire summary is done.